the official launch of the MKP Medics KwaZulu-Natal program. Healthcare professionals, both employed and unemployed, are gathering here today for a transformative event that aims to bring critical healthcare solutions to communities in need. This launch marks an important step in the MK Party's commitment to strengthening the healthcare system through a dedicated network of medical professionals. We spoke with Commander Sbu Donda to understand the objective behind launching this initiative.
The best way of looking at it is to look at our constitution as the founding document of this country, the South African Constitution. If you look at section 27, subsection 1, it guarantees access to healthcare services. Now, if you look at the performance of the health sector, especially the public health sector in South Africa, they are performing under par. It's poor performance. So the MK cannot sit, fold our hands when our people are feeling the pinch. Okay, so we have decided that we will have to partner with the medical practitioners that share the same vision with the MK Party, that of full social, economic and political emancipation of our people.
There are many reasons why MKP Medics has been established, but at its core, this initiative is about improving healthcare access and ensuring that communities benefit from sustainable health programs. By spearheading this effort outside of government structures, the MK Party demonstrates a proactive approach to addressing healthcare challenges in South Africa.
We've been told over the past 20 to 30 years that healthcare is free, healthcare is accessible, but the lived realities on the ground are way different from what people are told. So part of the main things was to address exactly that, primary healthcare, but over and above that, to be able to then shape the policy position of Umkhonto weSizwe Party where health is concerned, and ultimately shape the policy position of the country when we take over government. So it was imperative for us to start to demonstrate what the MK Party will do when it eventually takes over government. So we didn't want to just wait by the sidelines up until we take over. There is this hope. People must see what the MK Party will then do when it takes over government. So it was imperative that we come with programs that will address the challenges, particularly of Black people in the main.
It will also help the healthcare in the sense that the health pathing is, if you don't pick up disease early, the more the disease progresses, the more complicated it becomes to treat. But if I find you when you feel you are not sick and I do my screening, I find out that you have high glucose and I start treatment early. So the end organ damage is minimized because you started treatment early. So the fact that I came to you and I was able to pick up that you have an underlying condition, even though you are not aware of it, it will help you and also help the government or the general population, because then the health burden of treating you will be lessened.
One of the key highlights of today's events is a presentation of the program framework. Commander Dr. Jauke took to the stage to outline the structure and implementation strategy of the MKP Medics program.
But now we're going to divide the work into 3 different phases. The phase 1 part of it will basically be the mass-based community screening. So this is where inside KZN we identify malls, we identify shopping centers that we then go, we put up a gazebo of Umkhonto weSizwe, we put healthcare workers there and they screen our people. Exactly like what Dr. Biela was saying. You will be so shocked to find out how many people are walking around with ridiculous blood pressures. You will be so shocked to find out. We are no longer shocked because this is a lived reality that we have then experienced, and we then applied our minds and thought, if this thing is done countrywide, you'll find that at some point we may have a level of increase in terms of life expectancy, because these things are manageable. It's just that no one knows that they're walking around with them. So phase 1 of the work, it covers public screening, mass-based, inside malls, inside shopping centers, inside an area where there's a lot of people. That is phase 1 of it. And it's going to run between, it started in January already within the Gauteng, the Northwest area. So between January and December, we'll just be doing that. We'll also, after this, try to also get the buy-in of other provinces so that at the very least, this thing is being done the entire country. So that is basically phase 1. We'll pitch up inside taxi ranks, we'll pitch up inside shopping centers, and. Phase 2 of it, we will then be targeting specific population groups. There's no community that does not have the elderly. You then identify that as a specific population group. A team of MKP Medics would then identify, say maybe old people inside that community. You gather them together, you give them education about the management of chronic illnesses. You give them education about how to live their lives even in the presence of chronic diseases. After that, when you are done with the old people in the same community, you go for the young people, the youth. You go and educate them about the risks of substance abuse, for example. Go educate them about mental health, for example. You go educate them about sexually transmitted diseases, and. When you are done with them, you then go to the young mothers. You'll be so shocked to find out. How many kids show up in public facilities, Dr. Mtet, show up in public facilities, infants dead because the mother did not know how to care for the baby. It's very, very common. Most of the experiences we have of what we refer to as death on arrival is usually because it's a young mother who's coming with a baby and they did not know how to take care of that baby.
The enthusiasm here at the launch is undeniable as MKP members and supporters embrace this critical initiative. We spoke with Provincial Convener, Commander Willis Mkhunu, about what it means to launch this program in KZN, especially considering the current state of healthcare in the province.
These MK Medics are doing exactly what President Jacob Zuma has asked of MK Party members to do. The main principle of MK Party is Ubuntu. Ubuntu is about caring for one another in all respects. These medics have taken this step to fulfill the spirit of Ubuntu. Through this program, it is certain that the ordinary people who are poor and black will now access free health service. Ours will be to cooperate with them to improve this system until it is a country-wide system, even before we take over government, but in preparation for when we are in government.
As the event progressed, discussions moved to the immediate plans for MKP Medics and the next steps following the successful launch. Commander Dr. Biela provided insights into what lies ahead for this initiative.
We got a note from leadership which then gives us a direction in terms of what must happen next. We did say during the launch that we have target provinces, KwaZulu-Natal, Gauteng province, Mpumalanga province, Northwest and Limpopo. Then we'll eventually venture into your Western Capes, and there's a reason why Western Cape is the last province on our list. But our target population now is to launch in all these provinces, gearing up to the last province, so that this health thing is not just central to Gauteng province or KwaZulu-Natal. Our people are everywhere. Black people in majority are everywhere. So it's imperative for us to be able to be found wherever people exist.
In closing, the launch of MKP Medics has been a resounding success, offering hope to healthcare professionals and the broader KZN community. With a clear vision and a dedicated team, MKP Medics is set to make a meaningful impact on the healthcare sector. Stay tuned to MKP 24/7 News for more updates on this and other transformative initiatives.